Hello, my name is Dr S S Rawat. I'm a UK trained physician based in Canada. I've written over 40 blogs, and this blog is about childhood vaccination and vaccine preventable diseases in the province of Ontario. So first, going through the vaccination schedule. Here first I have some links on how patients can book vaccines at public health clinics, as well as links to how they can keep their records updated with public health, including an app which I also use called the Can Immunize app. So going through the schedule, the rotavirus vaccine is given at 2 and 4 months. It's an oral vaccine. Rotavirus commonly causes diarrhea and vomiting in children. The pneumonia or pneumococcal vaccine is given at 2 months, 4 months, and 12 months. The 5-in-1 vaccine called PDSL, which covers for diphtheria, tetanus, whooping cough, polio, and H influenza B, is given at 2 months, 4 months, 6 months, and 18 months. Flu vaccine is offered once a year after the age of 6 months. The meningitis C vaccine is given at 12 months. The MMR vaccine, measles, mumps, and rubella, is given at 12 months. And the chickenpox varicella vaccine is given at 15 months. And the booster of these two, which is the MMRV, is given as a combined shot between the age of 4 to 6 years. Along with that booster, there is one more 4-in-1 booster called Tdap IPV, which is tetanus, diphtheria, whooping cough, and polio, given at that same time between the age of 4 to 6 years. School age vaccinations are usually given in school, but due to the pandemic, they have been given at the family doctor's office as well as public health units. So there are 3 vaccines. One is meningitis ACWY, which is 4 strains of meningitis, in contrast to the one given at 12 months, which was just 1 strain, meningitis C. Hepatitis B vaccine is 2 doses given 4 to 6 months apart. Usually we just do it 6 months apart, and we can do it in line with the HPV vaccine, which is 2 doses of Gardasil 4 given 6 months apart. There is a Tdap or tetanus booster given at 14-16 years, and then from then onwards you just need a booster every 10 years. With that, the next part of my blog talks about vaccine preventable diseases and their prevalence in Ontario. So Ontario, just to put you in the picture, has a population of 15 million people, which is just under half of the population of Canada. Talking about vaccine preventable diseases now, invasive pneumonia or Streptococcus pneumoniae caused 148 deaths in the year 2019, which is pre-pandemic, in the province of Ontario. H influenza B caused 32 deaths that year. Invasive meningitis in Ontario that year, 2019, caused 6 deaths. I do not have the data for influenza for Ontario. However, in the country of Canada, there were just 6 deaths related to flu in children. Of course, there were many more in adults and older people, particularly those with weak immune systems. So 3,500 in Canada in 2019. For the following conditions, there were no deaths in 2019. However, there were hospitalizations. This is for chickenpox, whooping cough, measles, mumps, tetanus. And for the following conditions, there were no cases at all. Diphtheria, poliomyelitis. For more information, you can head on to my blog.